Your facility should have a transfer agreement with the tertiary centers where you commonly transfer patients. Even in the best of circumstances, initiating the transfer, getting acceptance from their facility, setting up transport, etc., takes time. It's best to initiate the process for transfer as soon as you recognize the patient will need to go, even while resuscitation is still in progress. So E then is incorrect. Now, all the hospitals that I've worked at have had a transfer protocol, but if your hospital doesn't have a transfer protocol, I suggest you consider setting one up because they streamline the process. And maybe your hospital admin will give you a bonus for setting it up and making things more efficient. Yeah, I know that's unlikely, but making this process more efficient will make your life easier and will benefit your patients who will get to definitive care faster. So take a look at page 250, figure 13-4 for a simple transfer form, a printed copy of which should go with the patient, even if you fax, text, email, drag and drop, or ask AI to send a copy over to the receiving facility. SBAR is a mnemonic used as a communication tool for patient handoff during transfer. SBAR stands for Situation, Background, Assessment, Recommendation. SBAR can assist you in summarizing the care that you've given to the patient prior to transfer. Table 13-2 on page 247 has an ABC SBAR template that you can use. Thus, for our question, D is the correct answer. If you look at page 245, you'll also see a resuscitation and stabilization outline that basically summarizes all the ATLS protocol interventions your patient may need prior to transfer. You can use that outline as a checklist before transfer as well. Remember, if the patient is being transported by air, then even a small, simple pneumothorax needs a chest tube before air transport. And in that case, a gastric tube should be placed beforehand as well. So answer C is wrong. It does make a difference whether ground or air transport is being used. It is your decision as the team leader to determine how the patient needs to go, by air or by ground. And although the key factor is the condition of the patient, you also need to keep in mind the capabilities in your area. If you're in a tiny town with one ambulance for the whole community, do you really want to tie up your sole ambulance for 2, maybe 4 hours to transport one patient to the trauma center 100 miles away? Also keep in mind weather. The helicopters may be grounded or roads might be closed due to weather. You must be aware of the circumstances in your area. So obviously, this is why B is also wrong. The accepting physician can certainly offer suggestions or recommendations, but the decision is yours.